If you want something done in a great way, you have to help others learn to do it and learn to do it as well as you can do it. And as soon as they can, you pass that on and you go do something else, being the leader in your practice.
Welcome to AMC. I'm Dr. Greg Miller. Does your practice suffer from micromanagement? Today, Dr. Todd Osborne is going to explore the concept of micromanagement versus macromanagement. His advice on developing teams is particularly helpful. If you find this video to be helpful, please click the like and subscribe button. Let's get started.
Hello, doctors. I wanted to talk to you today about management. Chiropractors have a history of being poor managers, and that ends up affecting our practices and how large those practices become and how many people we help. And one thing I want to talk about today is talking about macromanagement versus micromanagement. And I'm going to give you the 3 T's that's going to help you be a better manager, and in result, you'll help more people and help your practice grow and possibly grow beyond where you ever thought possible. So macromanagement versus micromanagement, and that compares directly with macro practices or macro profitability and micro practice or micro profitability. And micromanagement is a problem. It's an issue that we deal with in chiropractic for multiple reasons, but some of it is just control. We are control freaks, some of us. I'm guilty. And so I've had to learn to pass that on to other people, to give some of that control away so that they can help me be better at what I do. A lot of time we don't trust the people, our team members. We don't have that trust that they are capable of doing it, and we constantly correct them. And it's not constructive criticism the way management should be done. It's a constant stress on them. We're constantly correcting them or trying to do it for them. And sometimes we're a perfectionist and we demand that everything be absolutely perfect. And we're looking at the tiny things over the larger priorities. And so that's another thing that gets us in trouble managing our team members. And quite frankly, sometimes we believe we're the only one that can do it well. And man, there's something in my past. My dad used to say it, loved my dad, and he was great in developing me, but he had this saying, if you want something done right, you have to do it yourself. And I've carried that with me. And so I have had to change my thinking on that. And if you want something done in a great way, you have to help others learn to do it and learn to do it as well as you can do it. And as soon as they can, you pass that on and you go do something else, being the leader in your practice, in your life. Micromanagement is a stressful environment, okay? It is very stressful. It's going to lead to high turnover. We know that happens in the chiropractic world. It leads to poor creativity from your staff members because it stifles it. They don't want to try anything on their own because you're constantly looking over their shoulder, and ultimately it's burnout. And that's why doctors, you get frustrated because you feel like you're constantly having to hire and you're constantly having to train. And those are not the things that we enjoy doing. We enjoy seeing people and making a difference in their lives, not doing all the training and hiring and everything that it takes to do that. So here's the thing, docs, you can only do so much yourself. We all have a saturation level, and some of our saturation levels are higher than others, and we can do more on our own than most. But You will only do so much without the help of others. You need others. Now, do you need who you have trained right now? Maybe not. And that's the problem. We blame the staff members or the team members. We blame them. They're a poor staff member. And, ultimately what it comes down to is most of the time we're poor managers. And so I talk about this all the time. We hire good people, but we develop great teams. Okay? We hire good people, but we have to develop great teams. And we have a rule in our office, and that is this: the doctor only does what the doctor has to do. Now, that's not from an egotistical side of things, but ultimately, my productivity is the greatest when I'm doing what only I am trained and have certification to do. So I am adjusting people. No one else can do that in my office, except for other associate doctors that we have. So I have to be doing that. Anytime that I'm answering the phone, running the appointment book, taking x-rays, doing therapies, whatever else that might be, then that stifles my productivity, because now I'm doing something that someone else could be being paid to do in our office, and probably would be, if they're trained correctly, would probably be doing it better than I would be doing it, because that's not what I'm about. I'm about seeing the people and adjusting them. That's where my expertise is. So we have to hire good people, and then we have to train correctly and develop them into being great team members. And that's macro management. Macro management is hiring them and then training them correctly and then trusting them. Okay? So that's the 3 T's that I told you I was going to give you. You got to give them the tools. All right? You have to give them the training, and you have to trust them to do it correctly. All right? So if they're not doing a good job, guess who that falls on? It's you, because it's the training. You did not either give them the correct tools, and when I'm talking about tools, I'm talking about systems. Do they have a system for running the appointment scheduling? Do they have a system for how they answer the phone and how they answer patient questions? Do you have a system inside your office, procedures and protocols that they're able to train on, and then you can trust that they're going to do that because you put the expectations of what the needs are in your practice? So the 3 T's: tools, training, and trust. That is what will get you into more macro management and out of micromanagement. And ultimately, that frees you up, doctor, to do what you do best, your expertise. And ultimately, that allows the practice to go macro. Okay? It goes bigger in the practice, in your profitability. And so a couple of examples of this is associates. I still remember my first associate when he came into the office. Great clinical skills. He was trained and that, but I still remember having to let go and let him see that first new patient all on his own. That was difficult for me because to that point, I had ran the whole show. There hadn't been anybody else. I didn't have to trust anybody else, but I had to give that trust to let that doctor develop. And that doctor did just fine. And ultimately, that allows me to see a lot more people, and for our practice to see a lot more people to expand that. X-ray tech, if your state will allow, doctor, anytime you're in the X-ray room taking X-rays, that is decreasing your productivity big time, because I promise you that you can see a lot more people, patient visits, and the fees that you get for that are going to far outweigh what you get for that X-ray in there. And so if you can pay someone whatever the current market price is for an x-ray tech or someone to take those films, you're far more productive in doing that. And that's macro management. And I'll give you one last tool, a vision board in your morning meeting. If you have a vision board in your morning meeting, have 5 categories in there, and whatever you need to work on in your office. It might be patient visits, new patients, signed care plans, maybe missed appointments, thank you grams that are going out of the office, whatever it is. But you have that, and that can be your short management of the day as you go over that of where you're at for the week. Here's the categories we're winning in. Here's the categories that we need to have some expectations of improving upon this week. And you can do that in a matter of a minute in the morning. So I call it the 1 minute manager for the chiropractic office. So put that vision board into play, and that helps. But you're putting the expectations on your team, but then you're trusting that they are trained and know how to do it. So become macro managers so you can have macro level practices. Have a great day.
Doc, AMC is your guide to becoming respected, effective, and valued in practice. We know what works, and we prove it with our Grow Guarantee. If we can't help your practice grow, it costs you nothing. Text us at 904-966-4996 for more details. See you next week.